Welcome back. I got to sit down today with a young nurse entrepreneur from Nigeria, Arowosegbe Obafemi David. Femi was dreaming big for the nursing profession from the moment he entered nursing school, journaling his experiences, sharing his insights on nursing school challenges with other nurses and nursing students, and really focusing on transition to practice. He founded a nursing conference in Nigeria his final year in nursing school. That conference is now in its third year and growing. He's an author and a passionate advocate for the profession, and it was just so inspiring to hear the power of his voice and of his ideas today. You're going to love him, so don't go anywhere. This episode starts now. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by True Merit. Hi, everybody. Welcome back to Care Anywhere. I'm Lea Sims, your host. I'm excited today to sit down with Femi Arowosegbe, a nurse, passionate advocate for nursing. We're going to talk today about his journey through nursing school and how that ignited a passion in him for reaching back and helping other nurses through that process. He's an author. He's started a nursing conference that's very successful. So we're going to talk about all of those things today. Femi, welcome to the podcast. It's so great to have you. Could you tell our audience a little bit about yourself?
Okay, thank you so much. Thank you so much for having me here. Yeah, my name is Arowosegbe Obafemi David. I'm a registered nurse from Nigeria in Africa. Then I'm also a nurse content creator. I create inspiring content across my social media platform. I'm also the convener of the Nightingale Summit, a summit which helps in empowering and equipping nurses and nursing students in Nigeria and also in Africa. Then beyond that, I'm a very strong advocate for the Sustainable Development Goal 3, which talks about good health and well-being. Yeah, thank you so much for having me here.
Absolutely. Absolutely. It's so great to have you here. You know, the journey from nursing school to published author isn't typical for every nurse out there. So, congratulations to you for doing that. It's not an easy journey. What inspired you? Let's start with your book and then we'll work back from there. What inspired you to write Nurse Krypton Chronicles, My Inspiring Journey in Nursing School, and to share your experiences openly with the world? How did that come about?
Okay, thank you so much for that question. Because to be very candid, like talking about my journey being a nursing student to being a published author isn't something very typical. But I'm going to start by saying that I was actually inspired by God to pen down my journey in nursing school because when I started, it was about 2 months to my final years. That's when I got the insights to pen down my journey in nursing school because I believe strongly that God actually wanted me to inspire nurses and nurses students whereby they get to learn about my journey in nursing school and also, be a better version of myself. So I'm going to talk about, because my journey, how I found myself in nursing is actually very spectacular and very unique because I was actually studying aquaculture and fisheries at the University of Ilorin before. I was my 400 level at that particular time, and then I was not fulfilled there. I didn't find that fulfillment there. So I dropped out from that school and I started nursing afresh. You can see it's something very unique. So I believe strongly that God actually wanted me to share my story because there are a lot of students that actually had a particular course that they are not feeling fulfilled there, and so they didn't have the courage. But when I shared my story online and it's resonated with a lot of people, and they found that courage that yes, they can actually make a decision in order to like go for what they actually want for. So apart from there, I also shared my mistakes in nursing school. I talked about my challenges. I talked about the milestones that I achieved in nursing school because when I was in nursing school, I published books. I founded the Nightingale Summit when I was in my final year in nursing school. Even when I was in nursing school, I led 2 rural medical outreaches when I was in nursing school. And I did a lot of exploits through the help of God. So I believe strongly that the main reason why God actually gave me the inspiration is to ensure that the nursing students, the future nurses, get to learn from my story and they get inspired and also be a better version of themselves. Yeah.
That's great. In your book, and also a lot of your online, a lot of your online social content is really focused on addressing the challenges and triumphs of nursing school, which obviously there's a tremendous relatability there with global nurses who are walking through the same thing. Which moment or insight from your early days do you think resonates most with current nursing students worldwide? both in Africa and other places. What are some examples that maybe you call out in your book that highlight your challenges and triumphs in nursing school?
Okay, so I can say in my days in nursing school, I'm gonna say that one of those movements that I know that it's actually going to resonate with a lot of nursing students, not just in Africa, but also across Africa, and is actually about me managing my time. You know, when as a nursing student in nursing school, the syllabus, the curriculum is very bulky. And to be very candid with you, studying nursing is very, very demanding because the coursework load, you going for long hours, clinical placement, it's something that is very, very strenuous. Then also you also have other things you want to do in life, your social life,
Right.
a lot of things, and so it's really not easy balancing all these things together. So it's one of the thing I faced when I was like during my days in nursing school, and I know that a lot of nursing students, not just in Africa but beyond Africa, and also are facing this kind of challenge. But one of the things that actually helped me is that I learned how to prioritize my activities, and I was very intentional about my time, very, very intentional about my time. So I believe strongly that with this, a lot of nursing students can actually learn from that and also like navigate their path through this challenge. Then another thing is the emotional stress in nursing. To be very candid, as nursing students, there are a lot of times that you be emotionally down because as a nursing student you get to go for clinical placements and you get to see patients die, you get to see like patients suffer from a lot of pains. It's something that in one way or the other it gets to you. It gets to you. So it's one of the things that I believe strongly that a lot of nursing students are actually facing. And during my days in nursing school, I was able to like navigate this challenge by ensuring that I was very intentional about my self-care, very, very intentional about my self-care. I engage in activities that will actually help to improve my mental health. Very important. And it's something that I believe strongly that it's gonna resonate with a lot of nursing students, not just in Africa, but beyond Africa.
So, what were some of the things you did? I love this word intention. You've used it twice now. You were intentional about your time, managing your time, and you're intentional about self care. And we're hearing more and more about self care and how important it is, especially for nurses, not just in nursing school, but in terms of career longevity and burnout. That attending to mental health and self care is really important. What were some of the things that you did to do that, to manage
Okay,
your,
okay, thank you for that.
mental health? Yeah.
Okay. So one of the things I did was that I love journaling a lot in the sense that I like writing things down in my jotter. It's very important. So it's a kind of activities that I do that it helps me to relieve my stress.
Yeah.
Just journaling things down on my in my jotter. So it's one of the things I do. Then also I love listening to music. I love listening to music in order to like just in my free time and just to ensure that I am free of stress. You understand? So these are actually some of the activities I engage myself in. Then also I'm very intentional about my time, whereby I plan my day daily. I plan my activities daily. I know what I'm going to do today. I know what I'm going to do tomorrow. So it's very important. So I believe strongly that when you are able to plan your day, definitely you'll be able to plan your life. So it's very important that nursing students are very intentional about what they do daily and they know what they want to do daily and they plan towards it. So it's going to help them a lot to have time and also for them to prioritize their activities.
Have you gotten a good response to that when you talk to nurses? Because that's powerful. That's good advice for anyone, not just nurses, to be intentional about your activities of your day and making sure that you're including that. I love what you said about journaling because it helps get what's in your head and heart out of there and onto the paper. And then music puts something back in you. So it's a beautiful exchange that you're talking about. How has the response been when you share that with nursing students? Does it resonate with them? Are you seeing them adopt those same practices?
Yes, it actually resonated well with them. But the thing is that, we are all different. Some actually have other activities that they do that actually helps them a lot, you understand? So we are all different. So some actually, it resonates with a lot of people, while some also have like other activities that they do engage in that will help them.
Yeah,
So that.
probably exercise and physical activity. There's a lot of ways that people deal with it. That's powerful. So let's talk about the Nightingale Summit. You founded the Nightingale Summit, and you can talk about how far out of nursing school were you when you did that. This is an event for our audience that brings nurses and nursing students together for learning and networking. What was your original vision for this conference? Where did it come from, and how has it evolved over time?
Okay, I founded the Nightingale Summit when I was in my final year in nursing school, and I can say that I was inspired by God to do that. And I had a very great, a very simple vision for the Nightingale Summit, just to ensure that I create a safe space for nurses and nurses students to learn from each other, to share knowledge, to share their experience, and also to get empowered in order for them to thrive in in their different field. So I can say one of the things I also learned is that I learned that a lot of nursing students and early career nurses, they actually lack the platform for them to get to network with seasoned professionals, then also for them to have like great opportunities for development skills programs that would definitely help them to enhance their personal and professional growth. So that's one of the reasons why I started the Nightingale Summit. And over the years, the Nightingale Summit has actually evolved to becoming something bigger, even what I think about, you know. So we started in 2024 with just four nursing institution, and in 2025, the second edition, now it has over 12 nursing institutions involved in it, and we are actually planning for the third edition here, and we're making it a nationwide conference, you know, just to ensure that we have more reach and also gets more nurses and nurses students to be more empowered. Because one of the things about nurses is that and nurses and nurses is that they most of them think that the nursing profession is just about being a tax oriented profession, which is totally wrong. We actually want nurses and nurses students to start thinking as like being a leader, you know, being a change maker, being a problem solver, seeing problems and inculcating change in wherever they find themselves. So that's one of the reasons why I founded the Nightingale Summit.
That's so timely. You know, nurses are powerful problem solvers. We're seeing so many roles for nurses in mid, late career, even early career to step into solving problems in the tech space, you know, with care model evolution, with tech evolution. And so it's great that you're getting them to think that way right out of school, that this is a career with a lot of pathways and trajectories, and that it's not just bedside nursing, which is certainly why so many people get into it from the beginning. Um, you're you talk a lot about mentorship, so I'd love for you to talk about that a little bit, and multi-generational learning, the power of multi-generational learning. Those are passions of yours. How do you think structured mentoring can improve nursing education, clinical readiness, long-term career satisfaction? These things I think are important to lay the groundwork in the early days of a nursing career. So I'd love for you to talk about that a little bit.
Okay, so when we talk about structured mentorship is very, very important in the nursing profession, especially for the nursing students and also the early career nurses, because it's going to help them to translate the knowledge gotten from the classroom, ensuring that it's translated into the interpretation and also the application of this knowledge when they get to the real world practice. So it's very important because when there is good mentorship, it helps the nursing students to like enhance their clinical skills, whereby they get to apply it and they get to transit those skills faster when they start working as a registered nurse. So we can't the role mentorship plays in the nursing profession cannot be overemphasized because it's needed both for especially for the nursing students and also for the early career nurses. Because one of the things nurses like the mentorship helps is that it actually helps it to speed up the transition phase for nurses, especially the new nurses, whereby they get to like practice to become a competent nurse when they start practicing in the hospital. So it's one of the things I believe strongly that mentorship is very, very important in the nursing profession. Now, I also want to talk about the intergenerational learning because it's something that is very important. And this is not just about the younger nursing learning from the older nurses alone, but it can also involve whereby the older nurses are also learning from the younger nurses. It says that this is actually when wisdom meets with innovation. Yes, this is actually when wisdom meets with innovation, whereby the older nurses can learn from the younger nurses, whereby the younger nurses are bringing innovation, while the older nurses are bringing wisdom and experience. So it's going to help to strengthen the profession further, and it's going to make like everyone, both the older nurses and the younger nurses, to be more competent in whatever they are doing.
Absolutely. Many nurses, and you know, this is our connection to all of this, is helping nurses globally with their career journeys, with validating their skills and their credentials. Many nurses in Nigeria migrating abroad for work due to, pay and limited opportunities. How does your work through writing, education, and the summit, the Nightingale Summit, help shift perceptions and strengthen the profession there in Africa when many seek jobs elsewhere? I see the work that you're doing is building infrastructure and capacity and strength in Africa to enable nurses to stay and to work and to also be able to advance their careers right where they are and not have to seek those opportunities elsewhere. So I'd love for you to talk a little bit about how you're working to shift those perceptions and change that ideology where you are.
Okay, thank you for that question. Yeah, I'll start by saying it's true that a lot of Nigerian nurses are actually migrating abroad due to the low pay and also due to the limited opportunities in Nigeria. But one thing I would like to state is that one of the ways that we can actually strengthen the profession locally is firstly by ensuring that we shift the mindset of nurses and nursing students, because in Nigeria, the success picture of most nurses and nursing students is that yes, you have to just travel out of the country, you have to migrate out of the country before you can consider yourself being a successful nurse in Nigeria. And also the second thing is that ensuring that the environment that the nurses and nursing students in Nigeria, whereby we ensure that it's an environment whereby they tend to thrive, and also we are very intentional about their professional growth. Now, talking about my work, how my work has been able to strengthen the profession locally is firstly through my writing, whereby I get, and my writing aims to ensure that nurses and nursing students, it helps to shaping and change their perception about whereby they stop seeing themselves as a tax-oriented professionals and they start seeing themselves as a leader. And it's something very important whereby it tends to change them that yes, they actually can do more even in Nigeria and in Africa. Then also about the Nightingale Summit, one of the things the Nightingale Summit is that it actually helps to bring this platform whereby talking about the skill development programs whereby nursing students get exposed about what they can do beyond the bedside, talking about the research, talking about the social impact, because I can still tell you, like the first edition of the Nightingale Summit, the team is called Beyond. We had the team called Beyond the Scrub, whereby it's the main target of the main goal of the summit was that we actually want to expose nurses and nursing students to get to see the opportunities that they can do beyond the bedside. So we invited speakers, nurses who are doing exploits beyond the bedside. And so it's something that really helped them that yes, even though you don't travel out, you can still do more even beyond the bedside. You can become a nurse researcher, you can be involved in social impact, you can become a nurse content creator like me. You can also do other things, other things that can actually be beneficial and also strengthen the profession locally. Now, having said this, I would like to say this also because, my goal is not to restrict global mobility. My goal is not to restrict global mobility, but my goal is to ensure that African nurses are actually globally competitive and also why strengthen the nursing profession locally. So that's basically what I can say about that. So it's something for African nurses that's one of the works, the main thing my work does is just to ensure that it shapes their perspective that yes, they can actually do more beyond the bedside and also do great even locally in Nigeria. And
that culture shift starts with a mindset change. Right?
Yes. Exactly. Yeah. Exactly, man. Yeah. Then also, even when you look at the founder of the modern nursing, that is Florence Nightingale, you can see she did way beyond the bedside. You understand? She did way beyond the bedside. She was not just the bedside nurse. She was an author. She was a researcher. She's a researcher, and she's also an advocate. You understand? She did a lot of things. So I want us to look at the founder of the modern nursing, which is Florence Nightingale, the founder of the modern nursing. We can see that she did way beyond the bedside. She was a bedside nurse, but also she did other things. She was a researcher, she was an author, and she was a patient advocate. She did a lot of things, and that is actually telling us that even beyond the bedside is not outside nursing, but it is actually within nursing. So nursing is not just only talking about the bedside aspect, but also is talking about beyond the bedside is actually within nursing. So that's basically what I do to ensure that it actually helps to strengthen the profession locally in Nigeria and in Africa.
Yeah. Definitely it does. Student nurses, you mentioned earlier in one of your answers how important it is, the mentoring, to help with transition to practice, because that is a big challenge. And it's not unique to Africa. We hear it from nurses globally, that transition to practice from nursing school into a hospital or healthcare facility is challenging. It's challenging because there's now documentation requirements. There's all kinds of things that go along with clinical care. From your experiences helping students prepare for careers, what are the most powerful strategies you recommend for bridging that gap between nursing school and successful onboarding into their first clinical role? How do you address that? How mentoring is part of it, but what success stories could you share around what you're doing?
Okay. Thank you so much for that, Ma. So the very first thing I would like to say is that one of the things I do online is to ensure that I ensure that I teach nursing students about emphasizing about whenever they are on clinical placements, whereby they are very intentional about the clinical placements, and in a sense that they are not just showing up. There's a difference between you showing up and you being actively involved in whatever you're doing. So I ensure that I give them the advice, and I ensure that they get involved in whenever they're doing the clinical placements, whereby they get truly involved in it, whereby they learn from the experienced nurses, they are involved, they are part of the case scenarios. They do a lot of things during the clinical placement, because I believe strongly that when they are actively involved in the clinical placements, it will actually help them a lot whenever they start working as a registered nurse in the real world practice. So that's one of the things I emphasize for most nursing students, whereby I always emphasize that they should be very, very intentional whenever they are on their clinical placements, ensuring that they learn a lot during their clinical placements. Then I'm still going to fall back on the second point, and you talked about the mentorship aspect. Like I said, it cannot be overemphasized. Mentorship is very, very important, whereby there's a structured mentorship. It actually helps nursing students and also early career nurses to be able to transit better and faster whenever they want to work in the real world.
Well, you have somebody walking with you. I mean, there's the power of having someone who can advise and guide and direct, and you're not navigating that on your own. I think mentorship is so powerful, especially at that stage, and not just for nursing, a lot of careers. Mentorship in that transition from academia to real world practice really does require people to walk with you and beside you. And it does require you leaning in, like you said, participating, soak everything up like a sponge around you, learn from everyone, every preceptor, every person who is responsible for or connected to your pathway. So that's excellent advice. You touched on this a little bit earlier, but I'd love for you to go into more detail about what the perception of nursing is and has been in Nigeria historically. And I don't think it's unique to Nigeria. Globally, the perception of nursing in many countries has not been great. What has that perception been, and what do you think it will take to change that perception in your country?
Okay, thank you for that question, Ma. So historically, talking about the perception of nursing in Africa, in Nigeria, like you said, it has not been great, to be very candid, because a lot of people see nursing as a supportive profession, as a subordinate profession, which is totally wrong. It's totally wrong. Yeah. And that has actually affected the value placed to nursing. That has actually affected the way the public perceive nursing. So one of the strategies I can say that can actually help to improve this perception is firstly ensuring that we are very intentional about the way we groom the future nurses. And I'm going to state that in sense that talking about the curriculum, and I would love the future nurses, they should be more exposed to leadership courses. They should be more exposed to innovation courses. They should be more exposed to research courses. And I'm saying that in sense that because it's going to change their identity, whereby they stop seeing themselves as a task-oriented professional and start seeing themselves as a change maker. Because I believe strongly that for us to inculcate this change, for us to change this perception, we must start from ourselves first. It's very important. So when we change the identity, whereby future nursing students start seeing themselves as a change maker, start seeing themselves as a leader, start seeing themselves as a solution provider, it will definitely help the perception. Then secondly, the second strategy I'm going to talk about is talking about visibility, ensuring that what we put out there, what people start hearing about nurses actually change, whereby people stop hearing that nurses assist, but they start hearing that nurses lead systems, nurses innovate, nurses influence policy. It's going to change the narrative, it's going to change the perception by which the way people see nurses. So I believe strongly that when we are very intentional about those two factors whereby we are very intentional about the grooming and the training of nursing students, whereby they get exposed to things that will actually help to change their mindsets and also their identity. Then also being very intentional about what we put out there through the media space, through the social media, in order to inculcate all those changes. Then definitely the perception of the public about nurses will definitely change. So that's what I can say about that.
Absolutely. And the more the public sees nurses in leadership roles, see nurses in government, see nurses not only contributing to policy tables, but leading those discussions, leading tech development, improving solutions and tools at the bedside or in any spectrum of clinical care, people will see that. We've certainly seen that in the United States and other countries, and I know that that's certainly what it takes. Thank you. I think that's a great answer. And we're wrapping up now, so I want to ask you one last question. Looking forward, what are your aspirations for the Nurse Krypton brand? Are you going to have a follow-up book? Are you going to continue to publish? What are your thoughts about the book's impact, and how do you envision yourself continuing to grow as an entrepreneur around global nursing as a profession?
Okay, so looking forward, one of the things I want to looking forward, I want to continue being a source of inspiration for both nurses and nursing students, even beyond Africa, whereby the Nurse Krypton brand is synonymous to the inspiration, to professional development, and also to innovation. And also, talking about my book, Nurse Krypton Chronicles, I want it to keep being a guidance for nursing students, whereby they get to see themselves as a change maker, they get to see themselves as leaders, they get to see themselves as a problem solver. So, and definitely, it's something I want to continue. As I journey in nursing, I will definitely release the second part, whereby it's going to keep inspiring and guiding nursing students to become a better version of themselves. Then also talking about the broader discussion for nurses, I want to keep contributing my own quota and ensuring that the nursing profession keeps being at the top, ensuring through educational reforms, through policy engagements, and also through international collaboration, which is very important. So in the future, I envision nursing whereby nurses sit at the table of the decision making. Talking about the healthcare sector, I envision nursing designing systems, the perception of nursing change for better, especially in Africa, and that's it. Yeah, thank you.
Well, that's powerful, and you are at the front of that change where you are. Such an inspiration. I know to our audience, we have a lot of global nurses and global nursing students who tune in, who will be inspired by your story. Where can they find out about Nightingale Summit? Can you tell them where to go if they want to get connected to that event?
Okay, so yes, you can connect to the events on Instagram. We're on Instagram and on LinkedIn. On Instagram and LinkedIn, Nightingale Summit. Yes, on Instagram and LinkedIn. Also we're on YouTube. Nurse Krypton on YouTube. You can check for the Nightingale Summit, and you definitely have better updates about the Nightingale Summit.
Excellent.
Social media platform.
Excellent. Thank you so much, Arowosegbe Obafemi. It has been great to have you on this show. Thank you so much for sharing your experience and your expertise. Loved having you today.
Thank you so much. Thanks so much for having me.
Absolutely. All right, everybody, that's the end of our episode. We will see you next time on Care Anywhere. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at truemerit.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.